Good afternoon, everyone. This is Jeff from Brightsquid. Welcome back to our weekly series on virtual care. It's just a 15-minute little check-in on Friday afternoons to provide some tips and tricks for virtual care and how you manage that in your clinic going forward. Usually Mark is with me today. He's double booked. We're onboarding a lot of clinics at the moment, so Mark's quite busy with that, but he has recorded a demo for us special for today, so we'll get into that in a little bit. But let's dive in first. And let's just look at how we can improve care with the virtual front desk. So SecureMail provides the opportunity to do that with a feature called Shared Inbox that Mark will get into in the demonstration. But what clinics have done with that is reduce phone traffic by 30% by giving patients another avenue to communicate with the clinic that's much more efficient, much more in line with how patients are communicating outside of their healthcare life. And it allows you to triage messages simply with a forward button if need be, send patient concern that comes in through SecureMail onto the appropriate clinician or provider. Or even address patient concerns from anywhere. So nowadays, as people are kind of scattered across the wind, we have clinics that are operating fully. We have clinicians that are operating out of their house. So this allows them to connect with people anywhere at any time. And we can stay in touch with patients on a remote basis. And patients can send updates as need be when questions pop into their mind, and they can be addressed not necessarily in real time, because that's not always a requirement. It gives us that freedom and flexibility to maintain continuity of care, even without that actual contact of being in sync face-to-face or voice-to-voice. So it does help streamline patient management. And really what it does is it increases clinic efficiency because we can put all the information needed in one message. So any attachments that need to come in or go out, and that's true of the patient. If the patient wants to send anything into the clinic, as Mark will demonstrate, that's feasible as well. And all that communication is housed and contained in one channel of communication. It allows for group message threads. So if there's members of the healthcare team that need to be included on a message thread with a patient or about a patient, you can really set those up so that anybody can see what's going on and get the information they need. It allows us to focus expertise where it is most effective. So that means the MOAs are doing the scheduling, the intake, the assessment of what kind of response does this patient concern need, and how are we going to address it as a clinic, and then forward it to the physician as necessary, and the physician can take the steps that they really need to take. On top of that, as Mark will demonstrate as well, you can send information to patients in advance in terms of questionnaires, any other forms that you might need them to fill out to get the information that physicians require to make a decision or do a full assessment prior to maybe an in-office visit or a video consult, however that's being set up in the clinic and whatever is appropriate there. So the asynchronous communication reduces scheduling workload, which is key, and it allows for responses to happen as available. So like I said, patients can send questions as they pop up, or pictures or videos of things that can't be scheduled, like say tremors or maybe a seizure or something else that's going on with the patient that needs to be observed but can't be scheduled to see that in an appointment. So this is kind of what a virtual front desk looks like in a representation, right? Patients send messages through SecureMail. It arrives at the clinic inbox, and you can assign a number of different MOAs to have visibility into that inbox to deal with messages as they come in. So it's really a team effort, much like a phone would be in the clinic. So instead of calling a number, going through a message, waiting on hold, maybe you're having to call back later, patients can just send their message, know it's going to be dealt with, and whoever is available or whoever is in charge of the shared inbox at that time can address the message as appropriate, get it in the hands of physicians, and physicians can get messages back through the shared inbox to maintain that sort of clinic presence and connection with the patient, or if need be, if appropriate, to respond directly to the patient to take that conversation off to a one-on-one. So the virtual care workflow kind of looks like this, and this is simplified as much as it might look a little bit twisty, but really we've got only a couple decision points here. A patient sends in a request for care. through the virtual front desk. And on average, clinics see kind of in these are not normal times we're dealing with, right? But in normal times, on average, clinics see about 5 of these a day, so not a huge workload. And typically, statistically, about 3 of those require physician input. So just to kind of get your head around some numbers there, that's what we're looking at. So you have a clinical assessment. Is it required? No. Is this an issue the MOA can deal with? Then they deal with it and the patient issue is satisfied. Is there investigation required real time? So does the physician need to lay hands on that knee to see what it's like? Can they just look at it through a video consult? Or is this something they can address through a secure email message, a secure message like Secure Mail? And then we make those decisions and move on appropriately. So if it's something the physician can just handle, the message is simply forwarded to them. They can make the appropriate notes, provide the appropriate advice, and like I said before, either send it back through the MOA, through the virtual front desk, or go directly to the patient. Maybe they have some follow-up questions. If an appointment is necessary, the MOAs can now include any forms, any prep forms that might be needed. What information do we want to collect before the appointment so that the appointment is much more efficient and effective? Because you don't want to be sitting on a video consult or even an office visit or a phone call longer than need be, because we want to make sure we're getting through as many of those a day as we can. So this allows us to focus that time. And once that consult is done, maybe we're done and the episode is closed, or perhaps there's an e-consult required. So we can then forward a question on to a specialist and ask them for their advice. And that message can then come back to the patient. In Alberta, many of these interactions are billable, so some of the codes are up here, you can see that. Or maybe if there's no e-consult required first, perhaps we need to order services, send a requisition, prescription, or any kind of follow-up after the appointment. That can all be done through Secure Mail as well. So let's just get into the demo here. So I'm going to launch a video that Mark recorded earlier today. And once that's over, we'll be back for a quick wrap-up.
All right, in this short demonstration, we're going to take a look at the virtual help desk and how the front desk at an office can manage incoming messages from patients that are addressed to them through the Secure Mail service. Now, it's very similar to the way your phone systems are already set up, in that a patient sends in a message to the clinic or the practice, and it's managed or triaged and routed by someone working at the front desk. When and where it's appropriate, those messages can be routed to a specific doctor within the clinic, but in many cases, they can actually be handled directly by that person at the front, the clinic staff member, for example. So let's take a look here. In my shared inbox right now, we have a handful of messages that have come into my Secure Mail front desk. One from Brent, another from James, Adam, Jeff, and so on have sent in these various messages. So as the MOA on duty right now, whose job it is to monitor the shared inbox, and keep in mind, we assign or can assign a team of individuals to manage this front desk. Generally, it's going to be members like the MOA staff, like clinic receptionists, and whoever that might be. Meanwhile, the doctors and the clinicians are not sort of part of this part of the conversation. And you'll see here in a moment what I mean by that. So let's take a look at this first message from a patient named Brent. So Brent has sent in this message, and he's referring to a concern about a lesion on his arm. He's actually taken a picture with his phone, and let's take a look at that picture really quick. So this appears to be probably a mole. I'm no doctor, but this is, by the way, this is my hand. But he's concerned about this. So what I can do as the MOA on duty at the front right now is I can just forward this message directly to Dr. Fauchard. And so just like with regular email, I'll click on forward and we'll forward the message to Dr. Fauchard's, oops, I typed his name wrong. Pierre, there he is. And we just send this message to him. Now, he'll get this in his inbox. Dr. Fauchard can choose to respond back to Brent directly, or he can just type up a message and send it back to me, and then I can respond to the doctor, or sorry, to the patient on the doctor's behalf. In a moment, we'll switch our point of view, and I'll show you a little bit more about how that would look. In another example, I've got a question here from Mr. Olson, and he said that, my cough hasn't gone away. I'm obviously concerned about this. Can I come into the office for a virtual visit? Now, virtual visits, whether on the phone or via email, or sorry, over video chat, are certainly a part of virtual care, but generally not the main part. Most conversations will go like this, where the patient will ask a question through secure mail, and in some cases, it's absolutely appropriate to set up a phone call or a live video chat with the patient, but not in every situation. So what I would probably do in this situation is just respond to James and say something like, yes, we can certainly do a virtual visit. How's Monday at 3 o'clock? So Monday at 3. I would, of course, type something more meaningful, but in the case of today's demonstration, I'll just type that. And so now what will happen is James will get an email that will say the Fauchard Clinic has sent you a secure message. Click here to go and see it. James can then log into his Brightsquid secure mail account, view that message, and then we can begin that conversation around around that appointment that he wants to set up. Now, in another example here from Mr. Abel, his subject line is COVID-19 second test. Let's see what his concern is. So Mr. Abel is concerned because he has a sore throat and a deep cough and a head cold that won't go away. He had a COVID-19 test a few weeks ago, but he's still concerned. So I think in this case, we need to get a little bit more information from the patient, specifically as to how we can help them. So I'm going to reply to Adam and say, it's certainly probably a good idea to have you come in and get a chest X-ray, but I need more information from you. And my name is Clara in this example. She's the MOA at this office. So I'm going to actually send Mr. Abel a form that I want him to fill in. So I'll just take this assessment form that I've got on my computer, drag and drop it into the secure mail message, and then click send. So essentially, I'm just saying to Adam, it's certainly this is something to be concerned about. Please fill in this additional form about your respiratory situation, send it back to me. And once I've received that, then we'll take the appropriate steps, whether that's a virtual visit, whether it's sending you a lab requisition to go get a chest x-ray done. Those kinds of things can be followed up on. But the point is that all the work that I just showed you was all done by the MOA or the clinic receptionist. The doctor was involved in that other conversation regarding that skin lesion, but for the most part, this is all handled at the front desk side. So a lot of this back and forth negotiation we can do through secure mail. It's a lot quicker and more efficient than a phone call. Phone calls tend to have a lot of missed messages and voicemails and so on. The thing about phone is it's a very synchronous method of communicating, meaning that both the practice and the patient have to be on the phone at the same time. The wonderful thing about secure mail that we all have loved for years and years is that I can respond to an email at my leisure when I have the time. It's not something I have to do immediately. So lots of different things that you can do with Brightsquid Secure Mail to make your practice more efficient by using the virtual front desk this way. But I think that is enough for now. So hopefully this has got you thinking about how you can make your own practice more efficient using the Brightsquid Secure Mail service. Thanks very much.
Okay, so we're back. Hopefully that was helpful. We are right at the end of our time here, so I'm gonna just launch a quick poll, and so we'll get some answers to see, kind of get your thoughts on virtual care. And again, this helps us understand what topics we'd like to cover in the future, and kind of get a sense of what everybody's thinking in terms of the usage of virtual care. So just let us know sort of your thoughts on the prime benefit of virtual care, and we can hopefully address some more topics that align with what you're thinking there and what you'd like to do. We'll give it a couple more seconds, and looks like focus here is on modernizing care delivery. So obviously an issue that's ongoing, not just a current issue dealing with the pandemic, but something that will get going forward. As you're rolling out your virtual care program and continue to deliver it, make sure you are maintaining privacy compliance. There's already been issues through the pandemic with people's privacy being breached. There was one through the federal government that was well publicized. So we want to make sure that we're staying out of the news and keeping that patient information protected while we are maintaining that connection as well. So if you'd like to do a quick check on your privacy sort of preparedness, how you're set up to prevent privacy breaches, you can go to brightsquid.com and right on the web page, on the homepage, if you scroll down a little bit, there's a button to go take a quick privacy risk assessment. Just kind of get your head around. You'll get a score, and we can book some time with you to kind of review what that means for you and come up with some strategies to get your score improved. So thanks for tuning in today. We'll end there. If you have any questions, certainly feel free to send them our way. You can send them to contact@brightsquid.com. And this webinar will be posted for your review on our virtual care page. You just hover over the About page. You can look at the virtual care videos that we've done already. So thanks for tuning in, everyone. Have a great weekend.